Well, hello there, Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. Anyhow, today I'm going to address a question that I get quite often, and it's called, "Can a chiropractor fix headaches?" Now, from the title of my podcast, you know how I'm going to answer it. But one of the problems is most people are not aware that chiropractors treat headaches. And what happens is, okay, you got a bad headache. Everybody calls it a migraine, and it may be, it may not be. But the migraine, if you really dig deep into the, Dr. Google and get your medical advice, there's no, they don't have a cause for migraine headaches. There's no known cause. And what happens is any bad headache is linked in, lumped in as a migraine. And listen, the headaches suck to begin with. So there's no doubt in my mind that we're all on the same page with that. But as a chiropractor, where I see the greatest joy in practicing is when someone comes in with, to take a case history. And that's a question I typically ask. If you come with a back pain, I ask, do you get headaches? And I'm surprised at how often people said, oh, yeah, I get them all the time. Or I'm taking these injections. I got to go monthly for Botox at $5,000. I mean, insurance companies don't clamor to pay $5,000 a month for shots, but people are doing it because they're searching for relief. And the relief, listen, Big Pharma doesn't really have a way of fixing headaches. And listen, not every headache is going to respond to conservative chiropractic care. It doesn't work that way. But the majority that I see really do. I mean, I'm saying we have upward of 85% success rate, which is a heck of a lot better than having to take a shot every month or these pills that can really get costly. I mean, Big Pharma's out for Big Pharma. They're not out to solve your headaches. They're out to sell you a monthly, 5 times 12 is $60,000. Um, and that they have control. I mean, the media supports is supported by Big Pharma. If you take a look, how many times now you see commercials for conditions you're not even aware of, and that drives people into the doctor's office asking for a particular remedy. And same thing with headaches. I mean, you got Kardashian talking about a new headache thing that she's using and how happy she is with it. Fact of the matter is, the medical profession does not understand what chiropractors do. They poo-poo it at times or totally tell people, oh, don't go to a chiropractor. But if you're suffering from headaches, let me tell you, one of the things when you have headaches, you're probably not sleeping too good. And how can you function with a headache and not sleeping good? So now you have an extra added stress. And the headaches are a stressor themselves. People continue to suffer when there are answers. I mean, typically, I'll give you an example. It was a patient I had in today's Friday, on Thursday night. She came in with a hip pain from running. She was trying to run a half marathon. She just lost a lot of weight. She's taking good care of herself. She's exercising, eating. I mean, this lady lost 135 pounds, which is phenomenal. So she comes in, and then I started asking. I said, in the case history, she says, "Oh yeah, I get headaches all the time." She's not taking the Botox. She's doing something else, but the cost every month is about $5,000. So I said to her, I said, "Would you be willing to, try to go off your medication?" Because she only takes the medication when she has a headache, but she had headaches just about 2 or 3 times a week, and that's been going on for a long time. So we started treating her with conservative chiropractic care, and it should be. Now the other thing too is people are nervous it's going to hurt. Good chiropractic care doesn't have to hurt. I mean, if it's done properly, you're not going to hurt. Um, it kind of depends on the practitioner, their skill sets. Uh, I've been doing it for 30 some odd years, so I have a little proficiency at what I do. And the main thing is when a patient comes in, you want to be safe, you want to be comfortable, and effective. And that's what kind of where we operate on. So I was asking last night because the hip, she was able to run that half marathon, which is a great thing. And then I said, well, tell me about how the headaches are going. She goes, oh, I haven't had it since I started coming here. And that is so rewarding, but also perplexes me that people continue to suffer with headaches that aren't necessarily. They don't need to have them. I mean, they don't have to have headaches, but very few people will search out a chiropractor for headaches. And that's sad. It really is sad because, listen, if you go to a chiropractor and after a couple treatments you're not seeing any relief, then don't go back. I mean, it's really, I don't want patients who I'm not helping. And again, We don't help everybody that walks through our door, but it is so rewarding when you get someone saying, "Yeah, I haven't had a headache since I started treatment here." I mean, first of all, every medication you take has some kind of a side effect. It has to get processed out by the liver, but you know there are side effects, and there's no you always hear those commercials. They have to list the side effects, and they do so begrudgingly at the end of the commercial very quickly, but they get them through to cover their legal butts. So when I see this, it makes me kind of, you know, do a little bit more writing. So I sent an article. I wrote an article on can chiropractors fix headaches, and the answer is yes. But this is very self-serving, but it also happens to be the area I enjoy treating the most. I mean, back pains. You know, if I'm not doing a good job on back pain after 30 years, then shoot me and put me out of my misery. But the bottom line here is chiropractors can and do help headaches. And if you are suffering from headaches, either cervicogenic, which you're not going to be able to tell, you take an x-ray, you don't need an MRI, and the x-ray is going to show if there's tension on the base of your brain stem. So the top two cervical vertebrae, cervical 1 and 2, you have the brain stem is still there. It becomes a spinal cord right after that, but you have brain material. If you got a bone pressing on parts of your brain, would it make sense that it might hurt? I mean, realistically, so it's not really conjecture on my part because I see the results. But if you take tension off those areas, you can see results pretty quickly. You'll be sleeping better, and you'll have less physical stress on on your nervous system. So it's kind of a win-win if you think about it. You get better. I love what I do. I help more people. I'm Dr. Brian McKay. If you have any questions on headaches, I don't care where you are, 203 656 3636. 203 656 3636. Give me a call. I'm more than happy to refer you to somebody in your area, um, answer any questions because, one less headache is really, it makes for a really good day for me. And I enjoy having good days. Well, listen, it's Friday afternoon. I'm going to hit the gym. I hope you learn something about how chiropractors can and do fix headaches. Have a great day.